Hi, Dr. KORAY ERDOÐAN, Istanbul, Asmed Clinic. And I am in hair restoration field for 26 years, since 1999. Co-founder of World FUE Institute, located in Belgium. We are doing hair transplantation here. This is my third place that we moved. It's around 10,000 meters square and the most modern clinic in the world and the highest technology in the world. But we are accepting only 4 cases per day. With all our staff, we are doing only manual extraction and we are taking care of every detail of the surgery. We all know Turkey is the center of hair transplantation. Nearly 50% of cases are coming to Turkey, especially to Istanbul. We have many clinics here, but all the clinics has a relation with health travel agencies, except us. We contact with our patients one-to-one connection. We have a welcome team, all native speakers. So when you send an email, we start to take care of every detail of your surgery, your travel, and you don't need a hotel. We are not giving a hotel package. You can stay here and we will take care of you. We are doing only manual extraction. What are the differences of manual and motorized system? By using manual extraction, you can do much better homogenization in the donor area. So patients are here in a sitting position and we are supporting his chest by using QRS, and we are doing one by one manual extraction. If we need, we can split, so we can homogenize the donor area in a much better way. So with motorized system, for example, if you can extract 5,000 from a limited donor area, we can increase this number like 7,000 and the homogenization will be much better, so nobody will understand that you are transplant. No depleted patchy areas in the donor. Hair transplantation is related with calculations. You need mathematics because you have to make a perfect homogenization in the donor area. So that is the reason before the surgery, we scan the patient's donor area by robotic scanning system, and we are calculating how many centimeters square, how many grafts we should extract for a perfect homogenization. And we use all this technology for a perfect homogenization in the donor area. So even after this 5,000, 6,000, 7,000 grafts, nobody can notice that he's transplanted. But you have to calculate every detail. The caliber of the hair, how many follicles per square centimeter, how many hairs per follicular root. You have to know all these things, and you need a very high optical technology for scanning before the surgery. After manual extraction, you have to check each graft under microscopy. You have to check the quality of the graft and how many transaction rate, and you are checking the miniaturization rate of the follicles and telogen rate of the follicles. So if you check all this detail after the surgery, you can make a better planning for medication. After manual extraction, if you need more natural looking in the first front line, also my hair is transplanted, we use only singles here. But you have to find out the single ones and you have to place them here for the first front line and for the temporal peaks. By using robotic scanning system, we are pointing the single follicles and then we are using them while we are placing the grafts for the first front line and for temporal peaks. This is K.E.E.P, the most sophisticated system by using AI, scanning the donor area and the recipient area. So all these numbers that you need during the surgery, while you are doing manual extraction, you should know how many follicles you should extract from that area. So we need all these calculations by using this system. It's calculating how many follicles, the caliber of each follicle, how many grafts you have to extract. For a perfect homogenization, you need this system. And after the surgery, in the recipient area, it's calculating how many grafts transplanted per square centimeter. So you can compare the quality of the surgery, and the patient will know how many grafts transplanted and the density of the recipient area. Hair transplantation is a surgical procedure. So many patients are asking to me if it is risky to do the surgery or not, especially mothers. But you need anesthesiologist during the surgery, and you have to check all vital signs. During the surgery, we are checking our patients with wireless monitorization system and heartbeat number, oxygen saturation, blood pressure. During the surgery, even he make a break and go somewhere for the bathroom or something, he will be under control. So most safest way to do this is monitoring the patient under the observation of anesthesiologists. This is K.E.E.P, KORAY ERDOÐAN embedding placer. One of the most safest way to place the grafts is for premade incisions, and with no touch technique is autoclavable. But you have to educate your team, of course. Every surgical assistant, before touching any case, they have to place minimum 10,000 fake grafts into the model. This is a key head. This is a model for educational purposes. So first of all, your team should be very well educated before starting helping you. This is key photo. You know, before and after photos, you see every case is in a different angle, in different light, different distance. So for identical photos, by using the same distance, same light, and same angle, that's the system for before and after photos. We are using key photo system, so you can evaluate the result much better in a scientific way without any tricks. Long hair FUE is very popular and many people don't want to shave their hair. If you do by manual system, you are getting 100% long hair transplantation. So for 100% satisfactory long hair transplantation, you need a manual system for long hair. So nobody can notice that you are transplanted and nobody can understand. Another point is eyebrows. Eyebrows are getting more popular every day. So by using long hair, you can place the long hair into the eyebrow area and you can control your angles so you can get much more natural results. The reason of hair loss is different in men and women. For men, we have androgenic alopecia, it's related to testosterone hormone and dihydrotestosterone. For women, we have many different reasons. Especially it's related with the family history or sometimes after the birth. Because of the reasons are different, so treatment is different. So when you have general thinning, hair transplantation is helping but not working like medical treatments. But if you want to take your forehead lower, if you have a big forehead and you want to take it lower, if by time you are losing your frontline, in this case, hair transplantation in women is very successful, especially when they have any surgery for the face tip and if they want to hide their skies. Also, we are taking the frontline lower to hide them and you can get very natural results. Asmed is the only clinic not working with any travel health tourism agency. We contact with our patients one-to-one with our marketing team, with native speakers, and we take care of every detail. We are taking pick up them from the airport till the clinic, and you don't need a hotel package because you will stay in the clinic under our observation. The most important point is natural looking hair transplantation. It's really hard to do that because you have to catch every detail. For example, my hair is transplanted also. You need original single follicles in the first front line with the right angle and direction because each follicle has its own direction. It's like a curved direction, so you have to place key to place them in a natural way. So with all your details, Asmed is one of the most natural result clinic in the world.